the BLM people that if this is truly, if the study is held and we cannot dispute, if the first thing to do to ever reopen this is dispute the study. Because even if we go to the east, if we go to the west, it's got asbestos everywhere. So we're not going to probably get away from that. And a lot of the other riding areas in the state of California have it. So we're not, it's kind of headed that direction. That's next. So the next part about that is, okay, so there's asbestos there. And, this is no different than us taking risks. If we signed a liability waiver, seemed to be the only way for us to get to ride this again. Because although, again, we've got to have something ironclad, maybe we could work together with the BLM, maybe we could work together with the other entities to figure out how to get an ironclad liability form so that the spouses or the kids don't sue. Because that's I think, what this is about, is the lawsuits or potential for lawsuits, even though they haven't been there yet. So, that's, I think, one of the only things that what's that?
That's certainly a place to start. If you have something else you want to add to it, I'm sure we have other folks that talked about that, but anyone else want to introduce other issues?
There's a bunch of bullet points, obviously. Some of the takeaways from this group, obviously, was required that you have to wear a particulate mask, HEPA particulate mask, along with a liability waiver. Another great suggestion was, in order to get access, you need to get a season pass, which actually you sign the liability waiver agreeing to these things. So in other words, you get access, you get the season pass, and you get a liability waiver. One interesting idea that's out here as well is contractor sell the property to an entity who may actually grant public access, possibly for a fee. That's a suggestion. A number of things, obviously, mandatory bike washing station, a land trade. Just reading some bullet points that are on this board.
Thank you. It does sound like management actions, measures that we may be able to consider to reduce the health risk. Tom has his hand up. What's up?
It seems to me that the liability regarding the asbestos exposure obviously is a concern for everybody riding there, and that's what everyone's trying to find a way around. It seems like the idea of the staff, the rangers and law enforcement that are at the park, seems to be overlooked. But what if there was a way to eliminate the paid staff at the park and have a group of enthusiasts that are trained and volunteer and rotate out and say each of us volunteers to be a deputized ranger for 1 or 2 days out of the year, and that would greatly reduce our exposure as well.
We got that idea up there.
Everybody says there's liability with asbestos. There is no liability. Everybody's tiptoeing around here, and there's no liability at all. Nobody's ever sued. Nobody's ever got cancer. Give us our land back.
Okay, so this is getting into the issue discussion. That's an issue that you brought forward, and we've heard some of these management actions or alternatives to be considered. Does anybody want to expand on the issues? Stuff that we've probably maybe heard in the past, but new ideas. More than willing to have these brought forward now. We address them through our scoping report and analyze the liability issue in the RMP and the EIS, or what it may take to address that. So I'm encouraging other groups. Go right ahead, though.
Well, I know Rick was over there, and I jokingly said that the EPA did not shut down Clear Creek. They gave a report that said, hey, there's high levels, and whatever, and that it was a smaller group, and specifically, I think, Rick, you had fessed up to it. Thank you for stepping up. But that it was you that had shut it down based on that, but nobody had told you to do that. And I said the easiest way to then reopen it is to change your mind. Kind of in a joking sense, but if there was nothing laid down for us to, and there have been no lawsuits, and there have been no cases of thelioma, whatever the cancer is, if this has not existed, and you're just doing things proactively to hopefully not get a lawsuit, and you haven't had one in how many years, then it seems kind of, you know, a senseless thing. Change your mind, reopen it, and but now there's something that you sent to Washington and that they've had an issue, or they've agreed with the closure because of this information. If it never was done, then Clear Creek would be open today.
Well,
So,
Again, this is an issue, and
Yeah.
Rick, you can respond.
well, you wanted issues, so.
We didn't capture this idea that flawed process and the closure is not necessary. Conducting an EIS while it's open has been brought forward. Rick, you can respond.
Well,
I think what we need to
it's
hear
just
is
not a
new
liability.
ideas.
It's just not a liability issue. I mean,
Right. And
it's
there's
just, there's an expectation that the land management agency that is authorizing activity out there that results in a risk exceeding an acceptable range, which is essentially in the Code of Federal Regulations, states that if you exceed that risk, then you need to do something to reduce or eliminate that risk. And it's something that the guidance laws that EPA follows, they have a set of federal regulations that interpret those laws, and those are reviewed by Congress and approved by Congress. And this one standard of exceeding a 1 in 10,000 excess lifetime cancer risk is one of those standards that we're expected to follow. And so the question then to me was, how do I reduce or eliminate that risk? And so that's one of the factors. So it's a responsibility that we, I guess, is the way I interpret it.
Thank you. I think that is largely part of why I introduced the public trust doctrine and public interest principles, because it's not just a liability situation, although it's a valid issue to be considering and bringing forward. It's what is our responsibility as a federal agency, and we determined it was appropriate to deal with it using the process and the tools and the public involvement, that we can have and to maximize the awareness and understanding of the issues that we have before us, and what we can do, as Rick stated, to reduce the risk to what EPA deems acceptable levels. But I really do want to focus this on getting issues, being proactive in addressing them through this process. So I'm hoping to hear from folks. I understand that many of these things have been discussed, and that I'm encouraging to be brought forward now, but I would like this to stay focused on what we can achieve, not where we're at odds. So who would like to, I'm thinking of groups that actually were prepared to present some of their ideas.